guys, thank you for joining. I'm just getting everything connected and started. So just give us a moment here. Today we are hosting Nurse Janna Champagne. She will be going over cannabis. She's also a master herbalist, so she has a lot of background in regards to alternative healing. She also is bringing in her passion for natural healing because it extends through her current roles as a college professor, legal advocate, and consultant. So educating people is of her nature. She has a huge passion in this field. So I hope that her extensive knowledge serves as a wealth of interest to you guys today. We do host her through Navigator's platform. So throughout this live event, we will be sharing her link for consulting over cannabis, but also herbalism. So if anybody is curious of that, we will be linking it here in the beginning, but also throughout the live as well. So Jana, I'm going to go ahead and go off a video now. You can go ahead and start sharing your screen. So I'll hand it over to Jana for you guys today.
Wonderful. Thank you, Peyton. Hi, everybody. My name is Janna Champagne, and thank you, Peyton, for that wonderful introduction. I'm a board-certified master herbalist. I have a diplomate in medical cannabinoid science, and I'm a retired nurse, just to specify that aspect. I retired in 2022. So I am continuing to serve patients as a board-certified master herbalist, and one of my plant medicine specialties is cannabis therapy. And I've worked with thousands of patients, and so I'm here today to share with you my perspective of how cannabis can be used for cancer harm reduction. And of course, this is in cooperation with Heal Navigator, and I'm also collaborating with them, and I offer herbal consultations through Heal Navigator, the website. So we'll be putting that link in the chat for you if that interests you. So a little bit about me, my journey, and I came to cannabis therapy and herbal medicine through my own experience as a cannabis patient who happened to be a nurse. And this was following a complete health collapse back in 2012 that completely turned my life around. And I was actually labeled totally and permanently disabled in 2013. And today, much thanks to plant medicine, I am fully functional and working probably more than full time at this point. I'm also a special needs mom. I have a daughter with autism, and my outcomes combined with her outcomes using herbal medicine to manage our symptoms and manage our health really drives my passion for this topic that I'm educating you about today. And you'll see on the right her story actually published on the cover of a mainstream cannabis magazine in Barnes and Noble nationwide in 2017. So I'm happy to give you the link to that if that interests you. I know we're here today to talk about cancer. So basically, the take home is that following patient needs has led me to fulfilling many roles in the cannabis industry. My first role was as a patient, and then I became a grower and cultivator and began caregiving for patients. And that led to offering one-on-one and even group patient education, which I've been doing since 2015 through my business, Integrated Holistic Care. I am considered a clinical application specialist, having served thousands of patients to help them optimize their medical cannabis therapy outcomes through a well-informed approach and education and assessment. So very important when we're taking a medical approach with herbal medicine. I'm also a content author. I write for the American Journal of Endocannabinoid Medicine. In 2019, my state shut down all cannabis education of patients by nurses, basically shut down my business for a few years. And at that point, I pivoted and began educating medical professionals. So I have accredited content for nurses that began since in 2018. In 2020, I also became a university professor at John Patrick University, and I'm teaching for their graduate integrative and functional medicine degree programs that have a cannabinoid science concentration. I'm also the founder of Autism Safe Haven, which is a 501c3 nonprofit that has a mission of cannabis inclusive autism care resources. This, of course, was inspired by my daughter and her story and the benefits she has received from cannabis therapy that are not being accommodated in the care home environment currently. So I endeavor to change that. I'm also an award-winning medical cannabis product developer through Unity Formulas, which we'll talk a little bit about later. These are targeted use blends, and they ensure that patients are getting optimal therapeutic quality product that are also targeted for specific needs, which is very important. So in order to understand the potential benefits of cannabis for cancer, it's really helpful to know a little bit about the endocannabinoid system. Now, this is a system in the body that is vital for health and life, actually. It's thought that if somebody's endocannabinoid system was dysfunctional enough, life would not be possible. And that's because this endocannabinoid system produces endocannabinoids, which are vital nutrients. And when we say vital, we mean they're very necessary for optimal health balance, or homeostasis is our term for that. And a body that is out of balance is going to be showing signs of disease. So that is a big take home here today, that we produce endocannabinoids in our bodies. We have receptors through this endocannabinoid system and enzymes that break down the endocannabinoids that we produce. And when these endocannabinoids travel throughout the body and interact with these receptors, what it does is promote homeostasis or balance. And this is in pretty much every other system of the body. We have found links with the endocannabinoid system and the brain and the gut and the immune system and all of the peripheral tissues and all of the other organs. So it really is kind of the motherboard of our body. It also mitigates the stress response, which we know can be really integral to many different diseases. And what it does is it activates our restore phase, which helps us to eat and relax and forget and sleep and protect. And this phase is very, very important for health recovery once we become sick. And you'll see on the right, there's a picture of our CB1 receptors showing that they're mostly in the brain and central nervous system, and then the CB2 receptors, which are found mostly in the gut and immune system. And we'll talk more about those as we move forward here. So there is a condition that was coined by Dr. Ethan Russo starting in 2004, and he's written about it since in 2012, 2016. We're continuing to get updated knowledge on this condition called clinical endocannabinoid deficiency. What it reflects is that our bodies are unable to produce enough endocannabinoids in order to maintain homeostasis or balance. So this is found in all chronic illnesses. And endocannabinoid deficiency can result in systemic imbalances, meaning we're depleting our endocannabinoid stores, which means we're going to be deficient in endocannabinoids, and we don't have enough to keep our body in a balanced state. Causes of endocannabinoid deficiency include genetic mutations, environmental conditions. So if we're ingesting toxins chronically, for example, that's an environmental condition that could deplete our endocannabinoid system stores. Illness of any kind is also a cause of endocannabinoid deficiency, as it can deplete our stores, and then the endocannabinoid deficiency itself actually can contribute to chronic illness. So it's kind of like this downward spiral that patients get into. And cancer is one of the illnesses on this list where endocannabinoid deficiency is often a contributing factor. So one of the things I like to teach patients about proceeding with cannabis therapy is that we can access cannabinoids from a plant source when our system is deficient, meaning we can't produce enough of the endocannabinoids, namely being anandamide, which is our CB1 receptor agonist, or 2AG, which it acts on the CB2 and CB1 receptors in a different way. And so when we are deficient in these endocannabinoids and we're struggling to maintain balance in our body, we can access these cannabinoids through the cannabis plant, because the cannabinoids that we produce internally are synonymous with the cannabinoids from the plant. Now, it's very, very important that as we're approaching this topic with patients, that they understand what is optimal therapeutic quality cannabis, because it is not all equal for addressing health issues. So this is a very important aspect that I teach every patient that I work with that is pursuing cannabis therapy, is to follow these criteria to ensure that they're getting medical quality product. And to put it in perspective, only about 5 to 10% of the products on the market today meet these criteria in the United States. So these types of products can be very difficult to find. So the flow criteria stands for flower derived. So we want the medicine to be extracted from the cannabis flower, which is the most potent source for those cannabinoids and terpenes that we're after to help improve health. We want to make sure that it's lab tested. This ensures that we've ruled out any contaminant, residual fertilizers or pesticides that might be in the plant. Ideally, those aren't being used in the first place, but this proves that there aren't contaminants in the final product. It also verifies the potency, which helps us convert that into optimal titration and dosage for specific use. We want it organically grown. We want it toxin free. In cancer, especially, we want to be lifting the load off of the immune system, and toxins can be one of the heaviest aspects that bog down our immune function. So toxin free, very, very important. We also want it W whole plant, which means the flower is being concentrated as nature intended without stripping away any of the compounds. And this has been proven not only in my experience with patients, but also in the research as optimal for therapeutic use. Now, the cannabis flower contains more than 500 compounds. So we have those cannabinoids we've been talking about. There's over 165 that the cannabis plant produces. It has terpenes. There's more than 200 of those. There's antioxidants, bioflavonoids, essential fatty acids, chlorophyll. There's all kinds of beautiful ingredients in there that work together in a synergistic manner to really provide the best possible medical effects. So here's just a little bit of the research supporting the flow criteria. There was actually a meta-analysis of a whole plant cannabis formulation versus an isolated cannabis formulation, meaning it had been stripped down to one single molecule with CBD. And what they found was that the whole plant was more effective at 20 to 25% of the dose of the isolate. And this really translates into cost savings for patients who are often paying by the milligram for their cannabis therapy. They also found that there's more consistent response in the body when you use whole plant. And another study found that isolates exert a bell curve response, meaning it's going to narrow the therapeutic dosage range for any specific patient, and it's going to peak and then drop off and stop working. So I want this to put this in perspective for cancer. With cancer patients, they're often using very intensive levels of cannabis therapy. So according to this bell curve response, we start low, increase slowly, it's going to peak, but as you increase the dose, it's going to drop off and stop working. So this really exemplifies why we do not want to be using isolate or any other kind of stripped down cannabis product for cancer, because you could be paying a whole lot of money for a lot of milligrams and be on the right side of the bell curve where you're getting little to no benefit for that expenditure. I have written extensively on this topic, and there's one of the articles I've written. You can find all of my articles at jannachampagne.com, just like my name, if you're interested in learning more. So I want to talk too about how cannabis can be used for symptom management in oncology or cancer treatment. So an individualized and targeted approach is always optimal. There really is no one size fits all protocol with cancer, although I know Google may say otherwise. We believe in using an individualized approach, which includes a full assessment of the individual's targeted goals. What do you want to achieve from the cannabis therapy? Are you looking just to mitigate some of your symptoms of the chemotherapy, like nausea or insomnia, relieve the neuropathy, stimulate appetite? All of these things can be targeted with smaller amounts of cannabis therapy, and just to help mitigate and protect the body from some of the side effects of the mainstream cannabis treatments. So you can see on this slide, I have kind of broken it down. Oftentimes we see reduced reliance on pharmaceuticals, whether it be the opioids for pain, or the benzodiazepines for anxiety, sleep aids, or antiemetics to help reduce nausea and vomiting. We often see improved level of consciousness, meaning, get off the benzodiazepines and the opioids, and people tend to be more awake and aware and able to enjoy the people around them because they're not knocked out sleeping, like is common with these medications. With nausea, we love THC, CBDA. These can be ways to mitigate the nausea, help patients be able to eat, which is so important with cancer. that we keep our patients continuing to eat. So mitigating the nausea and stimulating the appetite, like we see over here on the right with the THC, CBG, or CBDA, can really help improve quality of life, help patients have the energy that they need from food in order to keep fighting the cancer. Very, like, number one priority for cancer patients. Improving insomnia, this is also really important for ensuring that patients can be as functional as possible. Relieving neuropathy and other forms of pain, very important. There's even compounds that might help with chemotherapy, brain fog, and fatigue. And you'll notice that, THC is not on every single one of these lists. Most of these compounds that are listed here are not intoxicating. THC is the one that's notorious for that intoxicating effect. But with a medical approach, we're always thinking, how do we help to optimize function? And we understand that THC that's taken during the wrong time of day or in the wrong context or too much too soon can all be a way to impair function, which we work to avoid. So there's really no need to fear the THC. There's lots of other options if that's just not something that appeals to you. We can target anxiety and depression, many compounds. Pain and inflammation, we can combine methods for good symptom management of that pain that might be impairing somebody's ability to enjoy life to the fullest. We also have a more intensive cancer targeting protocol, and this is a protocol I referred to earlier where we work up to fairly intensive dosing of cannabis therapy. This really deserves great scrutiny, especially if you're going to be combining cannabis with other pharmaceuticals, including chemotherapy. You really need to be assessed by a medical professional that understands these considerations and can help you to maneuver around any potential complications that can occur by combining different types of treatments. So THC is one that provides antiproliferative and anti-angiogenic effects to cancer cells. Basically, it can trigger apoptosis, which is a natural cell death mechanism that gets turned off in cancer cells. And this is how mutated cancer cells are able to proliferate and grow and spread, is that natural inclination for them to commit suicide has been shut off. Well, THC comes in and it can turn it back on. So that cell commits suicide in a very natural manner, gets flushed out of the body. Ideally, this is what should be happening if your immune system is functioning properly and strong enough, you won't get cancer in the first place. So this really speaks to how THC can help boost that immune system response to cancer and help it get rid of the cancer cells. It may benefit in various cancers. Now, I will say there is a type of cancer where THC, especially in intensive use THC, we're talking 75 milligrams and above, is contraindicated in hormone-driven cancers. So this would be hormone-driven breast cancer, where you have ER/PR positive designation, vaginal cancers, ovarian cancers, even prostate cancer. I'm careful with THC. We also have to remember that THC may be contraindicated if you're using immunotherapy. And that's a whole nother explanation that's a little more detailed, but basically they can counteract one another. There's no potential for harm there, but there is potential that you could, block out the benefits of the immunotherapy. And we want you to get the benefits of every therapy that you're choosing. So we need to just maneuver these a little more closely. CBD is also very, very high potency for cancer, and it can actually help to suppress the growth and the metastasis of cancer cells. And it does this through a pathway called GPR55, and it's the inhibition of that pathway that kind of cuts off the cancer from this source of nutrients that help it to grow and spread. Oh, I'm sorry about that. Hit a button. So this is optimal for most cancers. There are very rare cancers where CBD in high doses is contraindicated, and it would be serotonin secreting adenocarcinoma, simply because CBD also increases serotonin, so that can become too much of a good thing. So we're cautious around that. CBG, another beautiful tool for cancer. This targets a totally different receptor from the THC and CBD in a different way. It's a CB2 agonist, so it's great for targeting especially the gut cancers, the immune cancers, and brain inflammation, or any cancer that is causing brain issues can be targeted through the CBG. And really, I recommend high dose CBG for most cancers because it is so well tolerated. There aren't quite as many safety considerations as we have with the THC or CBD. It's also very accessible. It's legal under the 2018 Hemp Act, so available to all 50 states legally. Last but not least, on my these are kind of my top 4 that I recommend for basically every cancer is THCA. Now, this is the acid form of THC. So because it hasn't been heated, it is not intoxicating. That acid on there prevents intoxication. It's when we heat it and the acid falls off, it becomes THC, and at that point, it becomes intoxicating. So it's a very potent anti-inflammatory, which is a huge support for the immune system, which ideally we want to support the immune system and the terrain of the body and shift it to a terrain that is no longer supportive of cancer growth. So THCA is a beautiful tool for that target specifically. It works by COX-2 inhibition, so it works a lot like the NSAIDs, like Advil, for example, but in a way that's not potentially harmful, where Advil can kill your kidneys. And the research says that THCA has 12 times the anti-inflammatory effect of aspirin, which equates to about twice that of prednisone. So like I said, just a powerhouse for inflammation. I just worked with a breast cancer patient last week that was telling me her inflammatory markers were off the charts. And my first response was, let's get you on some THCA and see if we can help reduce those and get you feeling better. So for cancer harm reduction, when you're using, some people do choose to use natural routes alone, and that's completely their choice. Some people want to use both the naturals and the mainstream approaches. So for those people that are wanting to combine therapies, like I said, it's very important to have your situation assessed so you have specific information and directions on how to reduce any potential risk of combining these various therapies. Okay, that said, when you are using chemotherapy, you can add cannabis, and it actually helps to protect cells against the oxidative stress of chemotherapy. So it's protecting your healthy cells. It can also be helpful to reduce the nausea and cachexia, or that profound weight loss that we sometimes see with cancer. And so these are ways that cannabis can be used to reduce the harm that we might expect from chemotherapy regimens. With radiation, we see decreased side effects of radiation, like the nausea. We can treat that with the cannabis therapy. There's also research that supports that CBD can protect cells from the toxicity of radiation. Once again, the healthy cells. So very, very important for keeping the rest of the body and minimizing the impact of these potentially harmful interventions. And then with immunotherapy, we know that cannabis can help to enhance that immune balance, which is going to help the immunotherapy work even better. There are definitely drug interactions and considerations. Like I said, if you're planning to combine chemotherapy or other pharmaceuticals with cannabis therapy or other herbal medicines, you want to make sure that somebody that is knowledgeable about these potential interactions is assessing your lists and telling you if it's okay to combine them, and if so, how. Sometimes we have spacing that needs to occur. For example, a patient I was just working with was on Ibrance therapy, and she wanted to take CBD for hormone-driven breast cancer. And unfortunately, she was taking oral Ibrance. It has a 27-hour half-life. She's taking it every day, so there's really no room to fit in the CBD therapy with that regimen. Luckily, she's doing Ibrance 3 weeks of the month, and she can take the CBD the fourth week of the month. So that's kind of what we're doing with her to work around the potential issues. And it's because CBD uses a metabolic pathway called CYP450, very common to pharmaceuticals. And because it uses that same pathway, they can interact in a way where the CBD could either enhance or potentially block the benefits of that drug. There's other potential drug interactions with blood pressure medications, with antidepressant medications, with diabetes medications, narcotics, and blood thinners like Coumadin, where we want to monitor that INR because they do use that same pathway. So really any drug where you're cautioned not to ingest grapefruit is going to be one that is going to have considerations around using CBD. Now, there is a beautiful drug interaction review guide at Candir. Unfortunately, I have discovered that they don't offer much information on the chemotherapy drugs. So once again, please call one of our integrative nurses or book a consultation with somebody else that is knowledgeable on this piece. So the greatest risk for interactions with pharmaceuticals is at the high doses of cannabis. So if we're doing that cancer intensive approach. With immunotherapy, we keep the THC and THC low dose. Tamoxifen is another example where, oral dosing of cannabis is actually not recommended at all if you're taking tamoxifen. But we also have some inhaled options that might be helpful for just managing symptoms. Ibrance, which we mentioned, Kisqali is another one. Once again, this is not a comprehensive list, so always please have your pharmaceutical screened if you're going to go, if you're interested in this route. So we do at Heal Navigator have integrative cancer consultations available. It's a subscription model, so it keeps it very affordable, and you have follow-ups and the ability to reach out to the nurse or myself as an herbalist to ask questions, and we can monitor your regimen if needed and adjust it according to how your blood markers and your imaging and your cancer symptoms are progressing. This holistic approach is really optimal. We don't just focus on alternatives, but other lifestyle modifications that can be made to help reduce the terrain in your body and help it be less conducive to cancer growth. So some of the dietary recommendations that I pass to patients include eating organically. We want to be reducing the toxic load in your body. Very important. We want to be cutting out anything with sugar. And, if somebody really has a sweet tooth and they're struggling with this, the paleo sugars, the paleo diet sugars are fairly safe. That would be like the honey and the agave, the stevia. We want to stay away from the chemical sugars. We want to stay away from high fructose corn syrup. We want to stay away from cane sugar. Those actually feed the cancer cells. So it's very important. And some patients who are struggling with high sugar levels like diabetes, we might actually put them on supplements that help to manage those blood sugars in the blood so that it reduces that feeding of the cancer cells. So clean or no animal products, very important. Some of my patients do continue eating, eggs and meats, but make sure that they're grass-fed and organic and very, very clean. And then a lot of people do go with Mediterranean or vegetarian diet, and that's fine as well, kind of a personal choice. Another thing I talk to every cancer patient about is stress management. It's really vital for immune recovery, and it's really vital to make sure that your body can come back to a state where the cancer really does not like the environment and doesn't want to grow. Because stress does change the internal status of your body and your balance. So it's about being aware of your stress response and finding answers that work for you. I mean, we're all individuals. So for me, if I'm stressed out, I go and garden. My husband's stressed out, he goes fishing. So it's just about being aware and finding tools that work for you in those hard moments to help you reduce that physical stress response. And now we're on to Unity Formulas, which of course is the cannabis producer that is recommended by Heal Navigator. And Unity Formulas has a mission of improved success with CBD, as it's fairly dismal, only about 6% nationwide. We're doing this by providing optimal flow quality verified products and all that are also targeted use. They actually have a blend specifically for intensive use in cancer that has CBD and a bunch of the terpenes that specifically help to target cancer. They also have custom blending available if you have a specific need that isn't already offered on the line. They also offer free consumer education. Now, this is very superficial, 15-minute call where you can get guidance on which products might be appropriate and get some of your, basic questions answered. Once again, if you have more intensive needs, I really highly recommend booking with Heal Navigator with one of the consultants there. These are products with purpose, and 15% of their sales are donated to my nonprofit Autism Safe Haven. And Heal Navigator does offer a Unity coupon code, so you might want to screenshot this page. It's RETHN2 for 20% off of your purchase. And then if you're looking for the citations, they are here. And there's also on the Heal Navigator website under the blog, there is my article, Harnessing the Power of Cannabis for Cancer, which it talks a lot about the information that we've covered today in a little bit more detail. And so that's another resource that you're welcome to use. So gosh, let me see how we're doing on time here. It feels like I flew right through that.
You did amazing, actually. And I have some questions too. So if you're ready for some question answering, I'll pop back in to ask
Yeah,
away.
of course, I'm ready for questions. So let's hop
Okay,
right into it. I'll keep the screen up so you guys have that information.
perfect, perfect. So let me pull them up for you. 1 second here. So let's see. First question. Does cannabis help with radiation damage to cells or clearing with dead cells necrosis? My husband has GBM. Thank you.
Yes, there is research supporting that CBD can help reduce the negative impact of radiation. I don't know that there's any research specifically talking about getting rid of any senolytic cells, and there are specific therapies that might help with that. I just don't know of any research supporting cannabis for that use.
Perfect. Thank you. And do you have a specific strain that works for leukemia?
So when we talk about strains, it's really interesting. I guess we have a few minutes, so we're okay.
Yeah, we're doing good on time.
Yeah, we talk about strains, and what a strain is basically is a profile of the plant that's based on the dominant cannabinoids and the dominant terpenes that it produces. So we didn't get too much into the terpenes today, but the terpenes, you can kind of think of them as the essential oils that the cannabis plant produces. And there's more than 200 of them possible. And there are specific terpenes that have research supporting them for anti-cancer benefits. And so they're on Unity Formula's website under the intensive menu, there is a product called CBD Fortify. And it contains some of these terpenes that are specifically known to benefit cancer, one of them being limonene. There's several of them. And if with a brain cancer, like GBM was mentioned earlier, we might want to ask, to have another terpene added to make it better at crossing that blood-brain barrier. So this is what I was talking about. There's ways that we can custom blend to meet individual needs even beyond what we have offered on the line. So the strains are basically just what's the profile, cannabinoids and terpenes. And yes, there are really optimal profiles for targeting cancer.
Perfect. Thank you. And yeah, a lot of these questions are always about, specific diagnosis. And that's when, those one-on-one consultations are always beneficial to overview any current treatment someone's doing. As you mentioned earlier, there can be potential interactions. You don't want to lessen the effect of a treatment someone's going through, or maybe enhance one way or another. So there's a few other questions about prostate cancer. But what kind for him, what strength for pain and cure, do you know what you need? And again, I would assume that this is when those one-on-one consults would be really great.
Yeah. And there are products on the Unity product line that are targeted specifically for cancer and for pain, some of the symptoms of cancer. So there's daytime pain, there's nighttime pain, there's CBDA for nausea, there's a sleep formulation, there's anxiety formulations. And then there's the more intensive use products, which are higher potency. So the typical Unity formula jar is going to be around 600 milligrams per ounce. But for the intensive Fortify cancer targeting product, you can get it in 1,500 milligrams or in 3,000 milligrams per ounce. And so that's where we, not only is it targeted, but the potency matches the need for specific uses.
And what about breast cancer? There's so many questions about breast cancer because there's so many types of breast cancer, right? So some people are asking about specific strains or suppositories, this, that, and the other.
Yes. So for breast cancer, like I said, the main consideration around breast cancer is whether or not it's hormone driven. Does it have ER and PR positive receptors on biopsy reports? HER2 positive or negative doesn't really matter as much. we do know that when ER/PR is positive in breast cancer, that we want to really limit the amount of THC. We don't want to use intensive THC doses with hormone-driven breast cancer. And there's research behind this. It was done by Kristen Wolschlagel, who, of course, is one of the integrative oncology nurses at Heal Navigator. It's on ResearchGate and also cited in my citations. And she basically surveyed, what was it, 1,200 breast cancer patients. And the ones that had ER/PR positive and had used intensive THC had less positive outcomes. And when we dive, we're still kind of learning the reasons why. We don't yet fully understand all of the pieces of this puzzle around cannabis therapy because research has been stymied for about a century. But we do know that THC seems to increase estrogen levels. This makes it a beautiful tool for women like myself that are going through menopause and our estrogen levels are declining and is causing us symptoms. The issue is with hormone-driven breast cancer, especially ER positive, estrogen is feeding the cancer cells. So we don't want to be increasing the estrogen. In fact, oftentimes with hormone-driven cancer, they're putting you on hormone blockers or trying to reduce the amount of hormones in the system, right? So that's where it can become kind of complicated. Suppositories are another issue. Some patients swear that they receive benefits from cannabis suppositories. And one of the big highlights of that is that it's not intoxicating. And so some patients prefer that for their higher potency cannabis because they don't have to suffer the intoxication of taking large amounts of milligrams. The issue is that we don't have any evidence supporting that suppository administration of cannabis absorbs systemically, which is very, very, very important with cancer. Patients swear that it can help ease their nausea, it can help ease their pain, it gives them better quality of life. So as long as there aren't any aspects or considerations that would mean suppositories increase their risk, for example, if say they have a tumor in that area, we wouldn't want to be risking damaging that tumor, possibly injuring it and making it grow more. There are certain people that should not be using suppositories. But if people find comfort from them and there aren't any contraindications, I say go ahead and keep using them. But we're going to add an oral form or another form that we know is absorbing systemically to ensure that you're getting that benefit. And basically, one of my mentors is nurse practitioner Eloise Thiessen. She's now working for Stanford Hospital and implementing Ryan's Law, so helping patients balance their cannabis therapy with their other hospital treatments at Stanford in California. And she wrote an article, and it basically explains that if cannabis suppositories were absorbing systemically, that they would be causing profound intoxication because it would be passing through the liver. And we know that the colon, where we enter suppositories, is very, very prolific at reabsorbing water-soluble contents. Cannabis is fat-soluble, and most of the substrates we put in suppositories like coconut oil are fat-soluble. So that could explain why it's not absorbing systemically, why it's not passing through the liver, why it's not causing intoxication, is that it's just simply not absorbing very well. There are water-soluble forms that might work better as a suppository, and that's, just another potential option if that's really the only thing you want to do. So that's my little spiel on suppositories.
No, I appreciate it because I have people ask me all the time, and I don't think most people are able to get a very proper answer from it. So I appreciate you going into depth as much as you did about it because most people will do, at least the ones I talk to, they prefer to use suppositories. But then I tell them to talk to a cannabis nurse about other options that might make them feel more comfortable too. Somebody did ask about topicals. So topicals for skin cancer and also to assist with the after effects of using chemo from having arthritis. If you can use RSO or if there's a specific product that might work more better.
Yeah, Unity Formulas provides a couple of different topical balm options. There's the Fire Blend, which has some kind of warming herbs added with some CBD in there. And
Mm,
that can be great for like lower leg pain or improving circulation, neuropathy, things like that in the lower body. There's the ice balm, which has herbs in it that provide more of an icy, kind of like the peppermint feel.
mm,
And those are great for upper body pain. There's also an earth balm that's great for any wounds, like if you have skin cancer and you have a wound. Although I really love the concentrates for skin cancer. And I'll tell you the story of a patient I worked with, gosh, 2015, I believe it was, maybe even before. She was one of my first patients and very elderly. She was in her 80s and she had melanoma on the back of her leg and
mm,
back of her calf. And it was about the size of a silver dollar. And they were talking about putting her under general anesthesia and removing the tumor and, doing a skin graft for her, which of course, general anesthesia with the elderly can be really high risk. So she came to me and we started having her put full extract cannabis oil directly on that tumor. And I don't know if you're familiar with Phaco. Some of you might know it as RSO or Rick Simpson oil. It's basically the same thing. But it's this tar-like, sticky molasses type of substance. It can be kind of hard to work with, which is why I don't generally recommend it. The Unity formulas are basically the full extract cannabis oil that's been diluted into organic extra virgin olive oil just to make it easier to dose and titrate because it's also very hard to measure. But for skin cancer, you don't have to measure it, just plop it on there. And this patient, she had her pre-surgical consult with her doctor about a month after she saw me. And I had her putting the full extract cannabis oil on her calf twice a day, covering it with a bandage, leaving it alone. By the time she saw the surgeon a month later, the tumor had shrunk to about the size of a dime. And because it had shrunk, the doctor was able to remove the tumor under a local anesthesia. It spared her the general anesthesia and it spared her the skin graft. So that's the power of cannabis against cancer. So topicals are beautiful, wonderful tools for pain, wonderful tools for neuropathy, good, in more concentrated form for actual skin cancer or tumors. Now, do know that topical application of cannabis in most cases, now the woman that had the deep lesion from her cancer on the melanoma, that might be, a possible exception to this rule.
mhm.
Or if it has an adjuvant in it that helps it to absorb more deeply. But most of the time, topical cannabis does not absorb systemically. It's only for that local area. So that's just something to remember as well.
I guess because it has so much to go through, right? Where it's more bioavailable if you take it a different way.
It doesn't
So,
get through the base skin
yeah.
cells. So, there are topicals that add something like DMSO, which is an adjuvant and helps it to
Hmm.
absorb more deeply. So, like I said, there are exceptions to that rule, but if you have intact skin and you're putting a topical on your skin, it's not going to absorb systemically.
Thank you. I appreciate it.
Yeah.
And I'm going to jump over to the YouTube section since we are streaming on two different platforms. Somebody asked if you can elaborate on what constitutes as high dose, and then how do you consider RSO in this scheme? So those are just two questions. So,
Okay. So intensive dosing, what we call cancer intensive dosing, tends to start around 75 milligrams a day. Now, there is no standard protocol for targeting cancer with cannabis. It's very individual and people respond differently. So what we want to do is work them up to some intensive dosing and then assess what do the next blood levels look like? What does the next imaging look like? How is that person feeling? Are they eating? Are their symptoms managed? And we might tweak it from there. Now, especially, and I work with pediatric cancers as well. Especially with pediatric cancers, we see them needing far more intensive dosing. So sometimes pediatric patients will increase to even 300 or 400 milligrams a day. With adults, it's usually 100 to 200 milligrams a day, I would say in that range. But we also don't want you using more than you need because, most people are paying out of pocket for their cannabis therapy. So we tend to start low, increase slowly, hit that 75 to 100-degree mark for cancer and then reassess and see where you're at, how you're doing. Do we need to keep increasing, or are you responding well? So that's kind of the standard protocol. RSO, like I kind of compared it to FACO earlier, and that's only because the final product is the same, meaning that it's concentrating that flower as nature intended without deliberately removing any compounds. The difference between RSO and FACO, and RSO is Rick Simpson oil, FACO is full extract cannabis oil, is that, and when I hear a patient is using RSO, I always want to dive a little deeper and better understand how it was made. Because Rick Simpson, he was a pioneer, Phoenix Tears, he did wonderful work and helped a lot of people with cancer. So I respect him for that. What I don't agree with on his protocols is the way that he recommends making the medicine. He recommends using really toxic solvents like acetone and naphtha and isopropyl alcohol, and most of the time it was him telling patients to do this at home. So knowing too that it's likely not going to be lab tested and you won't see if there's residual solvents in there, like it's a recipe for making somebody worse potentially if there's toxic residuals that they're ingesting. So full extract cannabis oil is the same outcome, but made with organic, ideally, but always with food grade solvents. So that if there is residual in there, it's not going to harm anybody. So that's really the difference between the RSO and the FACO. Rick Simpson also just kind of has a standard general recommendation. I believe it's 1 ml per day for 90 days from memory. So it's not individualized at all to the specific needs of that person or that patient. And it's a protocol that may or may not work for everybody. In most cases, it's very excessive. In a lot of cases, the patient has decreased function because they're taking such high levels of THC. He doesn't specify to not take high THC with hormone-driven cancer. So like I said, he was kind of an early pioneer and I respect the work he did, but I disagree with him on a lot of fronts. So I would
Well, a
not.
lot's changed since then.
As no judgment. My
Yeah.
first RSO that my husband made me in 2013 was using acetone. So today I would say don't do that.
Right.
As we know better, we do better, right?
Exactly. Hey, that's all we can do. And I don't know why I didn't realize you work with pediatrics. I guess I should have put two and two together, and I'm mentally noting this for myself. That's why I'm saying it out loud. Because I get pediatric cases and it's so hard. Like I don't know where to point them in the right direction. And I mean, I talked to them about clinics in Mexico, but to have like a remote telehealth practitioner for them too. I mentioned Kristen often because she's one of the only ones that feel comfortable with working with pediatrics. So that's good that you mentioned that because I know I've recommended some of the pediatric family in our Facebook group. So hopefully they'll see this. So thank you for sharing that note too, for my behalf of helping people. Let's go ahead and move on just to a few more questions because these are some good ones. Somebody asked about the right to try law. So are you able to discuss how the right to try law applies to cannabis? I'm currently in California and getting a prescription. And getting a prescription has never been an issue, but there is a high probability that I will be moving to a state where it will be illegal according to the state. If you want more detailed information, please feel free to message me. But she wanted to kind of discuss the right to try law. And I think this is important because most people are in illegal states. So.
Yes. And I haven't really worked with patients that are utilizing the right to try law, at least not officially. Like, I don't know if you have to register for it or if there's some kind of formal process to protect you. So unfortunately, I'm not able to give, and that's kind of legal advice anyway, which
true. I didn't know if you had any experience, but I thought it was a really unique one compared to some other ones that were kind of coming in. It stuck out. So I didn't know if you knew.
What I know of it should be protective. If you have a terminal illness, which cancer is considered terminal, then you should have the right to try whatever you want, regardless of your location. Now, as far as whether, you might risk yourself a headache in the process, that's possible. And I've worked with a lot of cannabis patients that are not in states where they have real clear legal access. They're using the right to try law, for example, and it can be accommodated. It's sort of an individual decision. You have to decide whether it's worth the risk if, say, you have kids and they're in school and the school district finds out and they call CPS, or if you have an
Right.
ex-spouse that is looking to cause you a headache, like those would be reasons to be really cautious. Um, yeah, and unfortunately, I haven't had any patients that have flat out said, "Oh, I'm using this and this is how I'm doing it." So I don't have much information on that aspect,
No,
unfortunately.
but thank you for at least trying. And then another good question, and I think this will be the last one, but if anybody has any other questions, Jana is in our Facebook group, so she can go back and look and respond as necessary when she has a little bit of moment of time. So if you have any more questions, you can drop them down below. If you're not in our Facebook group, you can let us know through Heal Navigator's platform. You can message me also at Peyton, Paityn, at healnavigator.com. Email me through there, and I'll send you our Facebook link as well for those that are on YouTube. But somebody asked, how do I know if I am deficient in cannabinoids? So I thought this was interesting.
There are ways to assess that, we're learning. For example, there was just research that emerged last year by Dr. Bonnie Goldstein, where they tested children with autism and they found several salivary biomarkers that when they treated with cannabis therapy went from deficient to shifting positively towards normal baseline. So we are starting to get a grasp on how to test for endocannabinoid deficiency. I don't think it's something you could just go into your doctor at this point and ask for. I think it's more of a specialty item for research. But basically, if you read what Dr. Ethan Russo writes about clinical endocannabinoid deficiency, the criteria is basically, is your body out of balance? Are you suffering any kind of chronic illness? So if you have a chronic illness, you probably have endocannabinoid deficiency.
This is
So
interesting.
yeah,
I have autoimmune, so maybe I'm
there you
going
go.
to safely assume that.
Yeah, yeah, yeah. And my story, I didn't talk a lot about my outcomes, but I started cannabis therapy in 2013 just to manage pain. I had a very complex immune collapse, and I was both immune deficient and autoimmune at the same time, if you can imagine that. Different parts of the immune system. And so I started cannabis therapy just as an alternative to opioid pain medications, which of course can be deadly. They're killing patients every, 11 minutes now in the US from overdose. So, and as a nurse, I knew I didn't want to go down that path. I had seen what happened to patients using opioids chronically. So started it just for pain, and cannabis within 6 months actually balanced my immune system enough that I lost my autoimmune lupus diagnosis. My autoimmune labs went from positive to negative. That doesn't happen with our mainstream approaches. The prednisone and the Plaquenil and the other medications they had me on, I've never seen that happen with those medications. So that's really what got my attention and got me deep diving into this information, into this science that, by the way, I didn't learn about the endocannabinoid system in nursing school. They actually omit a system in the human body from anatomy and physiology in medical schools and nursing schools. So this is why if you go to a medical professional and ask them about cannabis therapy, they're likely clueless. It's not their fault. They weren't taught. But I found research that reflected that intensively used THC, which I was using THC RSO that my husband had made me, can actually be immunosuppressive, and it acts like the immunosuppressive drugs that they use to manage autoimmune. So it did that in a way that was much safer. And when I was off of the pharmaceuticals, all the side effects from the pharmaceuticals went away too. So it's just beneficial all around, in my opinion.
I'm gonna have a conversation with you. I have
Good.
Hashimoto's.
For
So
sure.
I had to
Yep.
get on medication for the first time, like for the past year. I don't like it.
I don't blame you. They're awful.
I'm like,
I would
one
think,
pill is going to equal 20 pills. I mean, I'm a very holistic mindset. For those that don't know me, on a personal level. I don't even take Tylenol for a headache. I'm like sprays of magnesium and taking electrolytes, things
yeah,
like this.
yeah,
So,
yeah,
I personally will probably consult with you, Jana. So you'll be hearing from
sure.
me soon.
Yeah,
Yeah.
anytime. Yeah,
But I appreciate you always. You're so like super knowledgeable. Even like on the herbalism side, I saw when you certified and finished up on that and stuff like that. And so applause to you because that's something I'm always curious into. Because herbs, I mean, there's
Mhm.
magic in the plants. You know, they can, I mean, that's what our medicine was derived from once upon a time ago before, you know, we had petroleum-based products we needed to get rid of. So
Exactly. Well, and that's what they did. They would find these herbs that work beautifully for something specific. And unfortunately, you can't, well, not maybe not unfortunately, thankfully,
yeah,
you can't patent a plant because Mother Nature holds those patents and she's not selling out. So
yeah.
in order to monopolize the profits off of pharmaceuticals, they have to find the active ingredient
Mhm.
and figure out how to process it so they can patent it so they can benefit from all of the profits from that compound. But in the process of reducing these plants from all of the hundreds of compounds found in many of them down to one isolate, and sometimes it's even a chemical synthetic, like you were saying, the petroleum products,
Right.
they ruin a lot of the medical value and they increase the side effects and they increase the risk factors. So, you know, it's done for profit, not for patients.
I think most people that are in this group realize that. I
Yeah.
mean, you know, you do what you have to do to save your life, of course, right? Like if you have to take a medication or do a certain treatment, and that's what's going to save you, but also to complement it with something alternative or to slowly navigate to strictly alternative. Or some people, they're brave enough to never even look in the path of standard care. I talk to people all the time that know they have cancer. They did just enough to get their diagnostics done, and now purely alternative. And round of applause to them. That's such a brave way to go. But brave for all of them, really. I couldn't imagine being in the position of having cancer or a very grim prognosis and not having medical professionals that you can trust in. So I always appreciate those that are on the side of things, helping others and walking their journeys. So thank you, Jana, so much for holding space for others and providing these educational webinars and sharing your knowledge through not only your personal experience, but what you've gained along the way. And all I can say is thank you. Thank you for hosting this with me.
Thanks for having me. And yeah, if you'd like to reach out, you can find me on the Heal Navigator website. I believe we posted the link. If you're in the Facebook group and you have a question, please tag me so I see it. I'm not on Facebook that much, and so if I might miss it otherwise. But yeah, I'm happy to help. And you know, as a retired nurse, I worked in the hospital, so I understand pharmaceuticals have their place, and I know how to balance both. You know, if you're having a heart attack, my gosh, don't sit home and use cannabis. Go to the hospital. They have drugs that can save you. So yeah, definitely. But when we're talking about chronic illnesses, the pharmaceuticals usually entail heightened risk factors, heightened side effects. They minimize quality of life. And oftentimes when people start cannabis therapy, they reduce their reliance on pharmaceuticals and end up with better quality of life and function because the side effects go away. So it can be a really powerful tool for that.
And cannabis, of course, isn't linear, you know, so that's what people have to really like understand, you know. I had people call in and prior to this webinar, you know, just like stuck on the fact of high THC, right? Like, oh no, not THC. But I'm like, but there's so many different parts of cannabis, you know, and but yeah, that's what you're here for, is to educate them. So thank you. Thank you all for attending and tuning in. Again, if you have any questions, please let us know. We'll send them over to Jana to get any type of answer to that. Again, she does do consultations offered through Heal Navigator's platform. And tune in soon. We'll have more live events here for our platform. Have a great day.
Thank you.